Hello, this is Dr. Mark Contos with iTube Daily Coverage here in London. And with me today is Dr. Frank Goes. And Dr. Goes is in private practice in Antwerp, Belgium. And we're going to talk a little bit about smile procedures, which he's very experienced with, and enhancement rates compared to LASIK. Dr. Goes, thanks for taking the time to visit with me today. The things you've been finding with enhancement rates with smile, very interesting. Let's talk a little bit about that. Tell me kind of what you've seen.
So until now we've been performing Relex Smile since 2 years and a half, 3 years, and we've done about 335 procedures so far. And what was amazing that we didn't have any retreatment yet at this moment. Right. And so we've tried to see how it comes, and we've taken a look at the literature, and we tried to compare the amount of retreatments that were necessary in Smile compared to LASIK or femtolasic. And we've seen that in the literature the amount of retreatments is higher if people are farsighted, if a lot of astigmatism, and in older patients. Mm-hmm. And we have seen an influence of the temperature of the room, the humidity of the room, and the duration of the treatment also. And I think these are the main principles that cause the fact that Relex Smile needs less retreatments than LASIK or femtolasic, because we don't do hyperopia with Relex Smile, we don't do a lot of astigmatism, but especially the room temperature is always the same. There is no influence of the room temperature, no influence of the humidity of the room, and the amount of the treatment that we perform is always the same timing. It's always 29 seconds, and even in patients who have high degrees of nearsightedness, it doesn't take any longer to do Relex Smile. It's always a closed environment, so this is the reason why we need much less retreatments in Relex Smile than in femtolasic.
Yeah, and so you have patients now that are out at least 2 years that you've not had to retreat. So it's really kind of across the whole board of the treatment spectrum. Patients with a little bit of nearsightedness or even more nearsightedness, like you were saying, up to 9 diopters. And even in that group, you're still finding that the refractive effect is held and you've not had to do any retreatments.
Yeah, that's true. We do a Relex Smile starting from -3. We don't do low degrees of nearsightedness, and one of the highest nearsighted patients that we treated was approximately -9, so we don't go any deeper, and we leave at least 280 microns of residual stroma in the eye. I think even it might be safe to even go deeper, but in the beginning we are always on the safe side. And we've seen that the amount of retreatment is so low because the fact that it's always the same thing that you do. You cut a lenticule in the stroma, and even if you cut the lenticule of -3 or -9, it doesn't take any longer, it's not any faster, it's always the same environment. And the reason, it's not only the fact that we need less retreatments than in femtolasic or in LASIK, but the accuracy of the treatment is also extremely high. The mean degree of nearsightedness was -5.5, and we ended up at the mean spherical equivalent of -0.05 diopters. So the fact is, Relex Smile is always in the same setting, in the same environment, and this is the reason why it's so accurate, I think.
Yeah, it's interesting because the data, is showing that the results that you're getting immediately after surgery are very, very good. I mean, the things that I've seen, and then as you go on, it looks like now, and that's the question is, well, how will these patients do a year, 2 years from now? How will they be seeing? And you're showing the data that you have now shows that they do extremely well. I think that's really exciting news, really, about the procedure.
Yes, the data show that the stability is really high, not only the accuracy and the amount of retreatments that is really low, although we have to admit that the recovery time of Smile or Relex Smile is a little bit slower than in LASIK or in femtolasic. In femtolasic, most of the time the next day you have a 100% result, and in Relex Smile it might be only 70 or 80%, and the next 20% you will only gain it after a few days or a few weeks. But if you tell these patients everything in advance, they will be able to cope with this, and they can start working or doing whatever they do after 1 or 2 days. And so the slow recovery time is not like in PRK or in LASIK. It's slightly slower than in femtolasic, but it's not much of a problem.
Yeah. Well, like I said, the data really, from the United States, of course, Smile is for us not a procedure that we can do, all throughout right now, but will be hopefully soon. But the data that I've been seeing that everybody's been presenting makes it look really compelling, and certainly a procedure that'll be really interesting to see how it gets going in the States. But I want to take a moment, thank you for visiting with me about all this. It's really interesting. Thank you.
Thanks for inviting me. Thank you.
You bet.